pop them up here on the table and we'll have a look here.
Hi, what's up? Oh, my goodness.
Looks like you had a big injury at some point.
They threw boiling hot water on
Oh
him
no.
and kicked him in the teeth.
Oh, poor buddy.
Oh,
All right, buddy. Let's have a look at you. Okay. Yeah, he definitely has that stertorous breathing. You can hear him.
Yeah.
Yeah, his nostrils are very stenotic. You can see they're almost, slit-like there. That's
Yeah.
pretty typical of the Briggs-Spellick airway syndrome. Let me see your side. Okay. Any coughing or gagging when he's eating or drinking?
No, I think he,
No.
he eats too fast though, so who knows if they were feeding him right or not, because he was very skinny too. So he's put on a little weight.
Jeez, a nasty burn here.
Yep.
How's his activity? Is he pretty active?
Oh yeah, he's a good boy.
He's got a little bit of hip dysplasia. His hips feel a little bit loose here. Hold on, buddy. I'll listen to you. Nobody. Okay. It's hard to hear, but I can definitely, his heart, there's no heart murmurs or arrhythmias. Lungs sound clear. But he just got a lot of referred noise from his upper airway. Buddy. Okay.
They kicked him around too.
Yeah, he may have some allergies too. You see, he's got some pigmentation in between his toes, skin folds
Yeah.
too. So we should probably have him see a dermatologist at some point. But yeah, we can definitely improve on his nostrils, trim his soft palate. He seems relatively young, so hopefully he doesn't have any evidence of the laryngeal
about
collapse.
9 months, I guess.
Yeah.
They're saying.
But we can definitely neuter him too at the same time. So we can get you guys the estimates. We'll look at scheduling. Again, they typically stay overnight just for observation, make sure there's no complications. But we'll definitely open his nostrils, trim his palate, and see if he has any evidence of laryngeal collapse. As long as he's not in stage 3, then this should improve his breathing and his quality of life, and he'll be able to be more active and not have to worry as much as overheating. Again, they still will snore afterwards, but it should improve, and the main thing is their breathing should improve, the cooling ability should improve, they should be able to be more active and have better exercise tolerance. So again, the risks with surgery with Frenchies specifically, because they are the most difficult of the breeds, with the Briggs-Spellick breeds, the bulldogs and the pugs, because they're so compact. Their mouths are really small, and they have big cheek muscles, and so it's really very little working space inside. So the risk of swelling after surgery is much higher in these little ones. So that's why we keep them here overnight for observation. After we trim the palate, we put little finger ice packs in there to help with the swelling. But the key with these guys recovering from the procedure is slowly, calmly. They wake up and start barking excessively, panting excessively, get very excited. Then they can have the airway swelling, and if that gets severe, we have to put a temporary trach in, the temporary tube in the throat, just to allow them to breathe until the swelling goes down. It's rare we ever have to do that, but just something you have to be aware of. And unfortunately, these breeds are also prone to aspiration or regurgitation. So we have special protocols for them to prevent regurgitation, prevent nausea. We give them antacids as well. So we try and do everything we can to prevent that, but even so, some patients can still regurgitate after surgery, and if they aspirate, it gets into their lungs, and that could be life-threatening. So we usually send him home with those same medications.
Right.
But even once he goes home, he has to be kept calm. We don't want him roughhousing, running, jumping, so just keep him in a calm, cool environment. We'll send him home with some sedatives. And the stitches, we use stitches in the nostrils. They're dissolvable, but we take a little wedge out on either side, so they'll have nice rounded nostrils afterwards. And those are dissolvable, so those will fall out on their own. And even on the soft palate, we'll trim that back surgically, and then we can actually stitch it closed. There's been some recent studies comparing laser, suture, and cautery, and actually the suturing has the least inflammation. Because if you think about it, when you laser or cauterize, there's a lot of thermal damage, a lot of burning of the tissue, and that causes way more inflammation. So these are the ones that's better just to do the standard technique and stitch them closed. So they will need to eat soft food for 2 weeks, but after 2 weeks, everything should be healed, and those stitches are also dissolvable. Then he can go back to normal activity after that. But you should see a difference in his exercise tolerance, his breathing, his snoring. So he should be, much more comfortable.
Yeah.
And then the Nooners routine, we'll have a small incision there, and again, we'll usually use dissolvable stitches under the skin, so nothing will need to be removed.
Yeah.
All right. Any questions, concerns? Okay. But other than his skin issues, I mean, he seems to be in relatively good health. He may have some orthopedic issues in the back, but a lot of these Frenchies, Bulldogs, they'll have loose kneecaps, they'll have some degree of hip dysplasia. It doesn't usually affect them that much clinically, but doesn't hurt to put them on joint supplements just to keep their joints healthy.
Yep.
But it's just unfortunately their breed, they're kind of squished together,
Yeah.
so they have a lot of other problems too. They can have back problems, knee problems, hip problems, the breathing problems. Has he regurgitated or anything? Have you noticed?
Yes, he does. Yeah.
Okay. So that's another thing that they can have is hiatal hernias, so they can actually, their stomach can slide through the diaphragm. They have found that it can be related to the upper airway disease because when they're having difficulty breathing, they're using the abdominal muscles, so they're putting more pressure on their abdomen, so they can cause the hernia to become worse. And they actually found specifically in Frenchies by doing the upper airway corrections that if they do have some regurgitation, it can improve. So sometimes it resolves. So that's another benefit of the surgery sometimes.
Okay. Very good.
Okay. Any other questions, concerns?
No.
Okay.
Yeah, that